Welcome to this episode of Patient Perspectives in HIV, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practice.cme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Darcy Wooten and her patient who has been living with HIV for many years.
Hi, I'm Darcy Wooten. I'm an associate professor of medicine in the Division of Infectious Diseases and Global Public Health at the University of California, San Diego, here in San Diego, California. And I am so thrilled to be joined by one of my wonderful patients, Ray, who has been kind enough to come talk with me this morning about his experience with HIV and HIV treatment. So Ray, welcome, and thank you so much for being here today.
Thank you, Dr. Wooten. It's a pleasure to be here.
Well, I wanted to first start off and talk about and hear a little bit about your experience when you were first diagnosed with HIV and what that was like for you.
Sure. So my initial diagnosis was from my family care physician, just as a result of a routine checkup. And at the time, I was, having the full panel of STI tests on a regular basis as I went in. And when I got the phone call from my doctor that said, "Hey, you need to come into my office because I have to talk to you." Well, that got my mind spinning because I was a little worried about what's my doctor going to talk to me about. He shared with me the results of the positive test for HIV. And I was shocked, but at the same time, my mind had already been going through what the heck could he have been wanting to talk to me about? And this was certainly one of the options that I had thought about because I knew that I had engaged in risky practices in the past and that this was a potential outcome of that.
And what, after kind of getting that diagnosis, what was your experience early on in terms of accessing healthcare and getting treatment for HIV?
Well, first I was ignorant, so I had no idea what to do and who to talk to and what even the course of treatment, or was there a treatment? What all of that looked like, right? So I was able to gather some information from him, but then he didn't have experience in treating HIV patients. So I was referred to an infectious disease specialist there in my hometown, had a chat with them soon thereafter.
Do you remember what those conversations were like?
I don't remember a lot about that time. It was a little fuzzy, but I do remember, just breathing a sigh of relief that there was an established treatment regimen. And, I immediately was willing and ready to jump right in and get started right away.
What were some of the things that maybe impacted you early on?
Yeah, I remember thinking about, all of a sudden the things that I was stressed about yesterday no longer seem very important today because I have much bigger things that I need to be focused on, including my health suddenly became much more important to me. I think that I initially had to decide, who to talk to about this within my family, who to share my diagnosis with, and who not to. And then think about, how does that play out as I begin treatment for it? How and who and when should I, be very upfront about treatment or not? And why do I always have this box of pills with me and so on?
I want to switch gears a little bit now and focus in and talk a little bit about the different medications that you've been on.
Sure.
I believe when you were initially diagnosed, your first regimen was a combination pill of 3 medications, efavirenz, emtricitabine, and TDF. And this was a very common regimen. I wonder with that first regimen, how you did with it, how you tolerated it, if you did have any side effects with it.
I do remember having some side effects. Initially, when I began treatment, I had a rash, which I believe was a common side effect that occurs during the initial few days or weeks of that regimen. The amazing dreams is another piece that I remember. And frankly, when I left that medication, that was a little bit of sadness that I was going to let go of those, because I never had any bad experiences with dreams. They were always just amazingly realistic and robust. So that was one I certainly remember.
So I think the next regimen that you were switched to before coming to see me was a more modern regimen from the efavirenz, emtricitabine, TDF, and you were switched to, again, a single tablet regimen that had actually 4 medications in it: elvitegravir, cobicistat, emtricitabine, TAF. And I don't know if you remember sort of that switch and what that was like.
I try to keep up with some of the literature and understand, hey, when something new is coming along, is this right for me? Would it be interesting for me? And then, have a discussion with my provider about it. I typically have extreme trust in what my provider is telling me. And so I was ready to, switch horses there. Hey, if it's better, great. I always want what's better. So let's go ahead and go for it.
Awesome. And did you have any side effects with that regimen or any issues, or was it a pretty smooth transition?
I don't remember any side effects there. I believe it was a pretty smooth transition. Outside of I no longer have quite as vivid dreams, which is something you certainly noticed, but it's a small thing to give up.
Yeah, gotcha. All right. And so the final thing I want to kind of switch to is what I think is a really exciting area in HIV care is the newer long-acting injectable antiretroviral therapy. And that's the long-acting injectable cabotegravir and rilpivirine that has been out a little over a year now. Mm-hmm. And it's really exciting for a number of reasons. But I think what, at least from my perspective, is really nice about it is that it just gives us one more option that we can offer patients. And it's always nice whenever we can have more options for our patients and really kind of individualize and customize our treatment regimen for what's going to work the best for each individual patient. I wonder if you could tell us what kind of your thought process and kind of some of the factors that went into you thinking about and deciding to switch over to that.
For me, it's super convenient to just not have to think about having to take a pill every day, to not have a pill in the medicine cabinet that, not everyone that comes into my house, do I want to explain why I have them there, right? So to remove that from my day-to-day and to just, I think not have the reminder of taking a pill every day, that has been liberating. It's been powerful. And so I am really enjoying the transition of not having to take a pill every day.
That's so awesome to hear. I love that. I know initially you started out when the medication was approved getting monthly injections. More recently, that interval has been expanded to getting injections every other month, but still having to come in to the clinic, have a nurse visit, and get those injections. Has that been super inconvenient for you, or have you been able to navigate that okay?
It has not been inconvenient for me. Again, I'm able to make it work in my schedule, and it has not been difficult. I think what I have noticed is that I forget about my appointments sometimes. And so I live by my calendar.
Yeah. And that, that's something that our clinic has thought a lot about, because there is this concern that if you miss injections, this medication has a very long half-life, but if you don't get redosed, then you at some point will have, subtherapeutic level of medication in your body, which, could then potentially pose some issues. And so we've really, in the clinic, tried to develop a robust system, although there's always room for improvement, where we track patients when their injections are due, making sure that we're reaching out to them by a variety of ways, which I know sometimes from the patient side can be too much when we send you emails and phone calls and things like that. But trying to make sure that we do as much as we can to facilitate, making sure that all of our patients come in so that they don't miss their injections. And I think that's an important consideration for any clinic that's thinking about getting this up and running or expanding this type of program, is to really make sure that you have the support staff to be able to do that outreach, because it's different and more intensive than pill medications and kind of reminders there. So that was one of our clinic's lessons learned about rolling out this type of program. I want to ask you, because I've heard different things from different people, mostly positive, but about the injection site reaction or injection pain. Is it, what is that like for you?
You feel it for sure. And so, it's 2 injections, 1 in each hip. And for the monthly dose, it's a little bit smaller volume. And in my experience, it's been correspondingly a smaller amount of pain or soreness. So the only reaction that I have had has just been, my hip's been a little bit sore. And for the monthly injection, it was sore for maybe 24 hours, 48 hours, maybe. The every other month, I've only done it a couple of times now. I'm 5 days out from my last injection, and I still feel it in one of my hips.
Your experience, I would say, is very, very, very similar to the vast majority of my patients who are on this medication, as well as patients in the clinical trials when they kind of tracked how this played out in terms of pain with the injections and things like that. I finally kind of want to end with, you are really one of my healthiest patients. You are sort of the pinnacle for sort of what we should all aim for in terms of just being totally on top of your healthcare, really doing amazing lifestyle, healthy diet, exercise, to really stay as healthy as possible. And I'm always impressed with how you're able to do that.
Life is short, right? Especially, having the diagnosis that I have, it doesn't necessarily mean that my life is going to be shorter, but I think I've come to appreciate, every minute and every hour a little bit more. And golly, there's a lot to explore out there. And it's so much easier to explore if you are feeling energetic and feeling like it's okay to go, walk around the marina and then go to the park afterwards and then go on a hike because your body feels up to it. And hey, why not have those explorations? Because, our life is not a rehearsal. It's a one-time event.
That's so great. And I really appreciate all of that insight, and those are life goals for me, and I am constantly inspired by you, as well as by all of my patients, in terms of how you're able to really live life to the fullest. It's very impressive. So I think we will wrap up there. I want to again just thank you so much for sharing your experience with everybody. It is tremendously valuable, and I think this is really where things are moving in terms of increasingly incorporating patient voices and experiences into education for healthcare providers, because that is just so important. We need to kind of still know everything in the textbooks, but really make sure that we're keeping things focused on what our goals and priorities are, which is ensuring and maintaining the health and well-being of our patients. And so I think that your sharing your experience is so valuable for not only patients out there listening, but all of our healthcare providers. We're just incredibly grateful. So thank you so much.
Thank you. I'm happy to help.
Thank you for listening to this episode of Patient Perspectives in HIV. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.